Hello. Hello. Your name, please? David Pello. David Pello? Yes. And how old are you? 45. And where do you live? In Chartres, France. Okay, that's a good place. It's a good country. I like that country a lot. David had previously been diagnosed with primary progressive multiple sclerosis. David was aware that current medical opinion considers this disease incurable. However, he found information about Professor Slavin, a leading specialist in cellular therapy, heard about his achievements, and contacted BioTherapy International for advice. I'll put this here. Do this. Close your eyes. Close your eyes. So do this. And I want to see if you swing or fall, okay? Okay. Then I'll tell you to do this with your eyes closed. You quickly touch the tip of your nose with the tip of your finger. Like this, just like this. And then with the other hand, like this, just like this. For some patients, it's not possible to do. Okay. At this point, usual chores like cleaning have become a tough challenge for David. 2 years ago, he was diagnosed with primary progressive multiple sclerosis. It occurs in 15% of patients with MS, a disease that affects the central nervous system. Let's simplify it by saying that the neurons are connected by electrical cables with a sheath of insulation, like a real electrical cable. Our defenses will attack this sheath, which is called myelin. Once the sheath is damaged, information doesn't pass through as well as before. It means that I'm losing mobility, little by little, very slowly. I may lose something else as well, but what is lost is lost. It won't come back. Sit, sit. Come on. Fatigue is the primary handicap. Since nerve conduction is not as good, everything is more difficult. Everything is an effort to be made. Walking is complicated, cutting a steak is complicated because I only have one hand. I don't have any strength at all in my left hand and left arm. In Germany, in a branch of the BioTherapy International clinic, David was treated with mesenchymal stem cells derived from umbilical cord blood tissue. These cells have powerful anti-inflammatory and regenerative potential. They are capable of repairing damaged organs and tissues. After the course, David came to Tel Aviv to complete his treatment. David, please tell us about your disease. How did it start? It began about 3 or 4 years ago when I was playing music. My hand would get numb after a while. Then it gradually got worse. Next it's my leg, and now it's my hand, my leg and my arm, and I feel very tired. So that's it. And when it started it was imperceptible, but now it's very perceptible. Okay, what kind of treatments have you received against multiple sclerosis? Like everyone else, I got boluses of corticosteroids, solumedrol to calm the inflammation. At first I had one every month, but it was damaging my bones, so we decided to stop. I then had a treatment called ocrelizumab, or Ocrevus in France, of which I received 4 injections. But I decided to stop because the progression didn't stop. Hello. Hello. I'm Dr. Slavin. What's your name? David Pello. Nice to meet you. Sorry, my French isn't very good. I hope you can understand me. I can understand you. It's better than my Hebrew. Great. So you come from France? How did you hear about our clinic? Who advised you to come here? I looked for solutions and I found you by myself. And where have you found these solutions? I came across a couple of articles about you and then got interested in them. Scientific articles. Yes, scientific articles. And patient testimonials too. All right, you received the stem cell treatment near Freiburg in Breisgau, Germany? Yes, I did. How did the treatment go? How was your experience there? I found it quite simple. 1 intravenous, some intramuscularies. Did you have any problems or everything went well? Well, I don't know yet if it's working, but I haven't had any problems. Everything went smoothly. Okay. And do you know the reason for you being here in Israel? Yes, for the second part of the treatment, which gives the cells better access to my brain and spinal cord, in the hope that they will work well within it. Exactly. Here we have 3 instruments to, I hope, make the treatment more effective. The first is the low-energy acoustic shock wave. By dilating the vessels. Yes, dilating the vessels so that the stem cell operating on the blood can better reach the brain. The second is the low-level laser light therapy, LLLT, to activate the energy status of the stem cell, AST, which aims to improve blood circulation, cranial magnetic stimulation, deep TMS, which activates nerve cells. This machine is effective in the treatment of multiple sclerosis. Whether or not you have received stem cells before, this machine alone has proven its effectiveness in the treatment of multiple sclerosis and other diseases as well. Yes. But the main effect is on multiple sclerosis. This machine can improve the situation without stem cells. But I hope that with stem cells it will be even better. I think stem cells plus deep TMS is better than deep TMS alone. Okay? Okay. So, I hope it all goes well. Although the treatment is safe, we can never be completely guaranteed of everything. We will see. Thanks to God, you will walk better when you get out. I hope so. It won't be thanks to God. It will be thanks to you. All right. Goodbye. Thank you for coming here, and I hope it gets better. I hope so too.
Apropos this case, I would like to take this opportunity to explain what exactly are the goals treating patients with multiple sclerosis, and also similarly other autoimmune disorders that are caused by reaction of patients' own lymphocyte against self. In the case of multiple sclerosis, reaction of lymphocytes, specifically T-lymphocytes, against the brain. So the first approach is at an early stage of the disease to try to induce by cell therapy anti-inflammatory effects to turn off the inflammation against the brain. In the second step, the goal is, if it is possible to accomplish, to administer multipotent stem cells that can be differentiated, as we have shown in the laboratory, to oligodendrocytes, because oligodendrocytes are the cells that secrete myelin. So theoretically, treatment of demyelinating disorder will require participation of oligodendrocytes. These are the cells that secrete myelin. Also, these are the cells that can have an effect against fibrosis, which is also the end result of inflammatory reaction. So these are the basic explanations for cell therapy, the role of cell therapy for multiple sclerosis. But in addition, we would like to add additional physical instruments, non-invasive and safe. One, that can expand the blood vessels to improve bioavailability of circulating cells into target area, in this case the brain. Secondly, low energy laser light therapy, which can activate energetic status of the cells, improve the transformation from DNP to TNP, and last but not least, the use of deep transmagnetic stimulation, which has been confirmed as effective for treatment of multiple sclerosis as well as other neurological, neurodegenerative disorders. So we hope that the combination of cell therapy on the one hand and these devices that can improve the effect of cells, or so we hope, will provide patients in need a better chance for treatment.